Clinical psychology is an interesting profession. Um, it is also a challenging one, especially here in the Philippines. The topic regarding psychology is still raw, and there are a lot of stigmas surrounding it. People often misunderstand the purpose and meaning of psychology because our understanding about it is lacking. It is lacking of factual context. Social norms regarding psychology is vast, and we often relate psychology as something cryptic. So for some people, it's weird. For some people, it's not something that is important. For some people, especially because of our cultural standard or the context of our culture, we think that psychology is invalid.
So one of the significant barriers that hinder us Filipinos to seeking help regarding their mental health is the financial and availability constraints. We are often faced with problems such as lack of mental facilities, lack of psychologists and psychiatrists because the topic surrounding psychology is still immature in the Philippines. Besides stigmas, the accessibility rate for seeking help regarding mental issues is low.
Self-stigma with associated fear of negative judgment, sense of shame, embarrassment and being a disgrace, fear of being labeled as crazy, self-blame, and concern for loss of face. Stigmatized attitude towards mental health and illness was reported was topmost barriers to help seeking among overseas and local Filipinos. This included notions of mental illness as a sign of personal weakness or failure of character resulting to loss of face. There is a general consensus in these studies that the reluctance of Filipinos to seek professional help is mainly due to their fear of being labeled or judged negatively or even their fear of pulling negative perception of the Filipino community. Other overseas Filipinos were afraid that the having mental illness would affect their jobs and immigration status, especially for those who are in precarious employment conditions.
One of the barriers is social stigma, which is a term given when a person's physical or mental condition influences other people's views of them or behavior towards them. So technically, there's a discrimination that causes a person not to seek help from mental health professionals. And it's not just the person with mental illness that is being judged, but also their family or whatever group they are in. So, social stigma creates fear in Filipinos to seek help because they get used to thinking that mental illness is a sign of weakness or a failure of character, and that it may affect their life and the society's judgment of the people around them in a negative way. They are afraid of the thought that they may bring disgrace to the family.
Perceived stigma is the fear of being discriminated against or the fear of enacted stigma, which arises from society's belief. Stigmatized persons may internalize perceived prejudices and develop negative feelings about themselves. And patients feel shame and embarrassment about having the mental illness. Mental health needs is a vague term usually mentioned as a justification for the development of a mental health service or program. The term might be referring to the needs for care that should be provided to people who have mental disorders.
Social support builds people up during times of stress and often gives them the strength to carry on and even thrive. But social support is certainly not a one-way street. In addition to relying on others, you also serve as a form of support for many people in your life. Thus, the positive influence of friends and family on mental health and formal help seeking of Filipinos is not merely to serve only as emotional buffer for stress, but to also favorably influence the decision of the individual to seek formal help. Financial capacity is a medical legal construct that represents the ability independently to manage one's own financial affairs in a manner consistent with personal self-interest and values.